25 years of clinical observations in psychiatric outpatient clinics have clearly shown that the music selected for the catharsis technique facilitates the emergence and release of emotions tied to past traumatic experiences. Like a fable, the music has the ability to draw patients' attention towards particular problems and their possible solutions. The music helps patients make associations between past experiences and feelings and encourages verbalization, both essential psychotherapeutic processes.
Well, what's important, I think, it's true that I was really amazed to see just how easy it is to return to one's childhood and the problems associated with it. Because in psychiatry, repressed memories, for example, are extremely hard to retrieve because of our self-defenses. Here, our self-defenses are somehow minimized. Yet, I find that it really respects the person because they aren't forced to do anything. They're the ones who really give the authorization or not to go beyond their defenses. It's a non-intrusive technique, and it respects people because they can go at their own pace. If you look at the results, I've been pretty amazed sometimes.
So the distinctive feature of the catharsis technique is that it allows practitioners to track patients' progress and patients to evolve at their own individual pace in complete safety. It also helps patients find a sense of peace and relaxation within themselves, inducing a personal authorization to let go in order to see things more clearly.
I had a real impression of peace. I was really relaxed.
Two therapeutic approaches can be used in parallel with this music: receptive music therapy and graphic expression under music induction. After studying nearly 5,000 drawings, a rigorous methodology was developed for use in psychiatric, geriatric, or pedagogical settings. The methodology draws upon specific conditions for music listening, observance of the music progression put forward by the composer, regular sessions and follow-ups. A system of self-evaluation, reference documents, data collected through drawings and verbalizations, and analysis of these data. Graphic expression allows therapists to observe the concrete effects produced through music induction. According to Dr. Michel Gabriel Mouret, allowing creativity to flow in drawing, painting, and collages during music listening helps patients discover themselves and lets those who observe their drawings get a glimpse of their mental organization at a particular moment in time. In this way, the patient is able to reacquaint himself with the underlying framework that supports his internal world, made up of strengths, weaknesses, mental and spiritual forces, all of which are stimulated and mobilized by the music. More powerful than conscious elaboration, the intensity of that which has been revived through music induction is preserved in the patient's drawings. Whether in a hospital, clinic, or a private office, patients are encouraged to verbalize their experience, commentary, and drawings after each session of graphic expression. The initial role that music induction has played by stirring up patients' past feelings may then be continued by connecting those feelings to memories through association. The technique is based on receptive music therapy associated with graphic expression. However, its cathartic function can also operate without graphic expression, making it easy to use in a large number of fields. It is intended for practitioners who wish to facilitate effective communication and the emergence of repressed feelings in their patients, and is suitable for all ages in nearly all medical fields. I shared the music therapy experiments that were conducted at Relaxazur with my colleagues, as well as the results that we obtained. Some of them were interested. Others can also benefit from it, not only in outpatient clinics, but also in intensive care clinics and hospitals. More medical personnel will need to be trained to use this technique. This technique deserves to be further developed. We need to secure its future by training people who will not only take over our positions, but who will also continue to enhance this technique.